And the psych ward says there is no need to worry. This asylum was built to help you.
Before the age of 24, the closest that I got to madness was as a tabloid reporter, interviewing a notorious sociopath whose quick wit made for a great story. I always thought that mental illness was cinematic, almost aspirational. But then my illness struck, and it nearly sent me to an asylum for life.
And just like the straps on the stretcher that you rolled in on, we are going to keep you safe and secure.
It's not safe for me here. The history of hysteria, that mythical female disorder that over the centuries was blamed on sensitive nerves or the wandering womb, leaving countless women having to fight for a diagnosis due to the skepticism that it's all in their heads when they ask me what I'm afraid of. I lie. I can never expose you because I am the puppet for the monster. And these hands have become his. CBS News reports that women on average are diagnosed 4 years later than when the conditions are recognized in men. According to the book Doing Harm, women at some point during their journey for diagnosis are told that their symptoms are due to anxiety, depression, or that catch-all be-all, stress. Through the poetry in The Psych Ward Says by Anita D. and The Monster by Olivia Likens, the prose Brain on Fire by Susanna Cahalan, and articles from the Huffington Post, Washington Post, and CBC News. It's not all in their heads. A program. Because I believe that the healthcare system should not be yet another place where women aren't taken seriously. I was sitting at my desk working on a story when I noticed this numbness in my right hand. Not to mention my thoughts were running wild and I couldn't keep them straight. I was getting worse by the day. By the hour even, but no one knew what to do. Another doctor said, "There's nothing wrong with you."
People with anxiety are often labeled as shy or quiet, or that girl who buries bodies in her basement. No one's actually referred to me as the latter, but I always assumed that that's what people are thinking. The background music swelled. I felt the pulse of the crowd, and I struggled to balance and grew dizzy and queasy, and I couldn't focus on the music. He is a parasite reaching with long sweet limbs through my body, through my arms. He is the little voice inside my head telling me bad things to do to myself. British psychiatrist Elliot Slater warned that too often a label of hysteria allowed doctors to believe that they had solved the mystery, when in fact they usually hadn't. He discovered 9 years later that more than 60% had been found to have an organic neurological disorder. So I go to the doctor. A 10-minute slot to explain it all. And
This isn't so bad. But you don't understand. No, you're not severe.
I'm just trying to tell you.
Just take these antidepressants. These are going to work. Just take this leaflet for therapy.
And the psych ward says, take advantage of the 5 to 10 minutes you have with the doctors. But understand, he has a list of patients as long as his pay stubs. So you won't be receiving any actual therapy while you're here.
I was forced to talk about it since I was about to release a new song, and I tearfully told them how the doctors told me that I was crazy for thinking that I was sick.
I'll have a wave of anxiety, and then the next moment I'm perfectly fine. Perfectly fine.
Pretending to be normal is exhausting. I was with my boyfriend one night after work, and he thought that maybe I was having trouble sleeping, but whenever he turned to face me, I was sitting upright. When he suggested I try to relax, I turned to face him, staring past him like I was possessed. Suddenly my arm whipped out like a mummy as my eyes rolled back like a monster's voices won't stop taunting me. I would never tell a young girl that she's unlovable or crazy or worthless. Within months, I began to experience recurrent visions of my body toppling over the edge of my apartment building over and over like a film reel on a loop. I had accepted death and could feel my body shutting down.
And the psych ward says, sit back, enjoy the plastic furniture and coloring books. We have old radios with no antenna, but the static is still loud enough to drown out the sound of the woman screaming into being.
I woke up in a hospital bed. I felt a thick mesh vest around my waist holding me to the bed. I wrap my hands around the rails and pull up, but the strap's sticking to my chest. Help! You need to get me out of here! I would never tell her to carve ugly, terrible words into her body, to hold a flame to her skin until she has burned herself so badly that the pain goes out like a light. And her nerves are dead. Just like she should be.
And the psych ward says, if we keep you long enough, maybe you'll eventually start to fit in. Or maybe, if we keep you locked up, you'll eventually start to act out. And we will be right here, waiting to prescribe you something, to label you with a diagnosis.
Women with lingering undiagnosed symptoms are often dismissed by the medical establishment. Many are unable to go to work, go to school, and have a high rate of suicide. So many of the reasons why they miss the connections between my symptoms for so long absolutely has to do with my gender. I was in bed for 2 years before I got my diagnosis. Whenever I first tried to sing again, I was terrified that my voice had withered away with my muscles. But when I opened my mouth, it was still there. After multitudes of negative tests, they finally said her brain is under attack by her own body. My diagnosis was physical, not psychiatric. A diagnosis that nearly devastated me. But I was one of the lucky ones. I didn't slip through a system that was designed to miss cases just like my own.
And the psych ward says, we didn't cause your social anxiety. We only heightened what was already there. We just want to see you reach your full potential as a patient. Remember, we told you this asylum was built to help you.
I am not you. This is only a body, and you are only a feeling. But I will survive, and I will love me.